Okay, I'd like to welcome everyone to our annual vision event. This is a very exciting time of year for me. And the vision event extends for 5 consecutive Saturday afternoons at noon. And it's an opportunity for all of us to get together and learn new treatments, advancements in both traditional and alternative eye care. The theme of this year's vision event is focusing on solutions, not problems. And I like a quote by Mark Twain. Many horrible things have happened in my life, and a few of them have actually come true. And I do believe that when you focus on your problems, that energy you put in tends to make that problem grow. And I'm asking all of you, let's focus on solutions. And that's one of the reasons why I selected Dr. Larry Wallace to be the first speaker. I could probably talk for an hour about Dr. Wallace. He's an amazing individual. He's an eye doctor, optometrist. He has a PhD, and he's devoted his life and professional career in studying the effects of light and vision, light on the ocular system. In fact, Dr. Wallace is the one that introduced me to light therapy. He's the past president of the College of Syntonics. And I think you're really going to enjoy his talk. All of you that are patients of mine are using Syntonic light therapy. Many of you are using cold laser. And I really look forward to Dr. Wallace's talk. Larry, it's great to have you to kick off the vision event. The floor is yours.
Okay, Ed, thank you very much. Thank you. Thank you all for being here. The title of this talk is Reflections on Light and Vision. It's the title of my forthcoming book based on 49 years of practice, practicing light therapy and vision therapy. And so the book is kind of a looking back at all the things that I've been exposed to and the different things that I've learned over all these years of practice. And so this lecture is extracted from that title, and to give you kind of an overview of the field of vision, optometric phototherapy, and how some of the things that I've been involved with and some of the technologies that we've applied to help people over the years. So this is kind of an introduction, and it's not, it just gives you now to expand your awareness of vision, and also your awareness of the way light is being used in various ways to correct visual disorders. So optometric phototherapy is the use of light, but vision therapy is more of a general term of doing certain kinds of techniques to improve vision. And some of the concepts that are integral to this is that vision is really emerges as a total mind-body integration. Your eyes are not separate from the rest of your body. All your eye movements are always connected to your neck and to your inner ear and to your nervous system and to the environment you're in, and the consciousness that you bring, the awareness that you bring to vision. So vision is really a total mind-body integration. And so when we treat vision problems, it's not like you're treating the eye. You've got to start treating a holistic approach, treating many different systems at once. Another basic concept of vision therapy is that vision is learned. That is, it develops, and it's not something, when you're born, you have to develop your visual skills, make new connections with your brain and all through your nervous system and lots of different aspects of your mind. And it's trainable because it develops and it never stops developing. And because it's a learned process, you're never too old to improve your vision. So one of the aspects of vision therapy is trainable through training sensory motor skills. That is your ability to take light in, process it, and then integrate it with all your motor functions. We're going to be focusing not really on vision therapy, but more on the light aspect, which is a form of optometric phototherapy. And the first part, and the main part of this talk is to be about syntonics. Syntonics is applying selective ocular frequencies through the eyes into the brain to balance the autonomic nervous system and treat vision problems at their source, and that is through different non-seen pathways, subcortical pathways, including the blood and the water in your body, and many of the vision problems you have are just symptoms of imbalance through your whole nervous system and through your whole physiology. It's not, the problems in the eye are just at the end result in the eye, but the source is deeper into the brain and all these other systems. So Syntonics allows one way to get into the brain and to start to manipulate the way light is processed and the way the nervous system supports vision. So many vision problems are really symptoms of imbalances, specifically in this case, in the autonomic nervous system, which is the sympathetic and parasympathetic branches of the autonomics. So one of the ways we diagnose vision problems related to the autonomic is through looking at the pupils, looking at visual fields, that is your peripheral vision, especially its sensitivity to motion, movement, and to color. And also looking at things like heart rate variability, which allows us to see the autonomic nervous system in real time. So there are certain syndromes that are presented to the diagnosing doctor, and it allows you to kind of figure out which aspects are out of balance and then how you can apply light to rebalance the physiology and correct the vision problems. So Syntonic has very broad effects. The light is, again, not the light entering your body also goes through these energetic pathways that are non-seen, which we'll elucidate a little bit in a few minutes. But some of the effects are that when the light goes into your eyes, it has physical effects throughout your whole system. And that includes your bones, your organs, and your tissues. Light has chemical effects, and the way we manipulate those chemical effects is through the neuroendocrine system, through the hormones of the major endocrine glands. There are physiological effects of light into the eye, which affect the nerves, the energy in the nerves, the energy of the whole body, and the metabolism all the way from the cellular level into more global regions of your physiology. And there are psychological components to all physical problems. And so the light therapy deals with emotions, it deals with the mind, and it does it through an energetic approach, not through a talk therapy, but through balancing certain brain centers that support your emotional well-being. So all these four basic aspects of your existence are all being affected by light, and we can use light to affect changes throughout all these systems. The gateway into your brain with the light is, of course, through your pupil. Pupil is the most sophisticated electronic scanning device ever devised. Pupil is changing its diameter thousands of times a day. And what it does is it modulates the light coming in. And inside the eye is kind of like a black box. It absorbs light, but also emits light. So light coming out of your eyes, out of your whole body, are coming out of your pupil. Most of it is not seen by you. It's in the form of biophotons, very small packets of light that your eye isn't able to detect. But you can detect the overall light coming out of a person's eye by shining light into the eye. And also just when you look at people, you can tell a lot about their whole being by the way the light is reflecting out of the eye. So we're very interested because the pupil is changing to the autonomic nervous system. It dilates when when the sympathetic system turns on, it constricts with the parasympathetic. We can tell about the balance of the autonomic nervous system by very detailed measurement of the pupil, and that's part of the diagnosis in our treatment. When we shine light into the back of the eye, and this is a picture of the retina and choroid, the very back layer of the eye, and you can see in this drawing here, this is the optic nerve that I'm pointing to, and that's transducing the electrical energy that's going into all these tissues, the retina, and sending it onto your brain through the optic nerve. When we shine light into the eye, we can directly impact the vascular system. All these blood vessels in your eye are exposed when we look into the eye, when we shine light into the eye. The blood vessels have a huge impact the light affecting these blood vessels has a huge effect on the whole body. In a 20-minute treatment, and that's a typical treatment for exposing a certain light into the eye, you are exposing 40% of the blood supply of the entire body. So there's so much blood flow because the eye is the richest end organ in terms of blood flow. Between that and the choroid, the layer below that you can't see, you're irradiating energy into the whole blood supply of the whole body, 40% of it as you're just taking 20 minutes. So there's a whole aspect of how the circulatory system is carrying light energy and information throughout every cell in the body. So it's a very powerful modality to be able to look at this and see the vascular system of your whole body, but also to have effects on it so profoundly and so quickly. So it goes and carries the messages throughout the blood supply. And these are just a schematic of all the blood vessels going everywhere in your body. It almost instantaneously starts affecting, cascading through your whole circulatory system, the light frequency energy that's being put in there. Now there's this whole non-image forming pathways that I just was alluding to. And this is a complicated picture, but there's all these different brain centers that are listed here on the right that have non-seen factors. So the light, most of the light is going into the cortex of the brain to provide imagery, but at least 20% of all the light energy is going to all these other brain centers, which are integrating with all the different kinds of various brain functions of the central nervous system. And this integration and all these systems can be affected by the frequency of the light you're actually putting into these systems. One of the main areas that it goes is in something called the thalamus. The thalamus is right here in the midbrain. Surrounding the thalamus is the third ventricle, which is full of cerebrospinal fluid. There are 4 ventricles. The cerebrospinal fluid is responsible for sending hormones, sending all kinds of electrolytes, all kinds of information to all the cells of the brain through the fluid. So you're affecting the fluid information pathways here. But the thalamus itself is more of a neurological center. The thalamus has direct connections to the pituitary gland and the pineal gland, which are right in this same area. So they can dump their hormones right into the blood supply, affect the nervous system and into the cerebrospinal fluid to go to all the brain cells and eventually through the whole circulatory system. The thalamus, let me go back here for a second. The thalamus also is the main gating center for sensory motor information. All these things that you see and hear go through the thalamus, and the thalamus has certain frequency outputs to go to different brain centers. So the thalamus can limit the sensory input or expand the sensory input by certain modulation of these frequencies coming out of the thalamus. In addition to that, all the motor nerves, all the efferent motor nerves from your spinal cord all go through the thalamus. So the thalamus can reduce your motor function, your motor input, or it can expand the motor input to certain areas. So we call this, different filters of light can either inhibit or excite both the sensory input or the motor output going through the thalamus. So that's one of the main gating centers, connecting to many other systems in the brain, but it's a big one. And the light going into your eye goes directly there. It has a major pathway directly to that center. There's other light absorbing centers. You have cytochromes, which are light accepting molecules throughout your skin, your body tissue, and your blood. Photons of light are absorbed, and they regulate biological and biochemical reactions, such as oxygen consumption and production, reactive oxygen species, which is involved in inflammation, and things like the nitric oxide, which is a major signaling hormone for your whole parasympathetic nervous system, dilating blood vessels and relaxing, you're having all kinds of effects. So there's a lot of light information going through the skin and the tissues in the blood. One of the other major parts of this third ventricle that I was just showing you is the hypothalamus. Hypothalamus is the basically the center brain regulatory or auto-regulates the whole autonomic nervous system. It's the main station where affecting the pituitary gland and hormones, and it regulates many things, the hypothalamus, such as your enteric nervous system, which is your digestion, your GI tract, your metabolism, your respiration is being affected, your heart rate, your emotions, your sex drive, your immune function, body temperature, sleep cycles. These are just some of the major things that are regulated by the hypothalamus system. And the hypothalamus does this primarily through energetic pathways and also through neurohormones. So syntonic phototherapy is defined by the application of specific light frequencies into the eye to bring balance or syntony in the autonomics, which support our vision. So it's not the color, it's not the wavelength, but it's actually the frequency. The higher the frequency, that is the vibrations of each specific color, have specific energy quotients. The short wavelengths, the blue have the highest energy, and the red have lower energy. And when you're putting the light into the eye, not only you're doing all these visual things and stimulating all these other pathways, but you're putting energy into the whole brain system. And the genius of the Syntonics, which was invented by a physician named Harry Riley Spittler back in about 1930, he wrote the book. Actually, in 1940, he wrote the book, The Syntonic Principle, that defines all these different pathways and all the different effects light has on the physiology of our systems. So he figured out which frequencies had different effects: the sensory, motor, relaxing, stimulating. He could target different glandular effects by knowing what frequencies to put into the eye. That was the genius of Spittler. So again, imbalances in the autonomic, sympathetic, parasympathetic, create vision problems, and they can be addressed at their source by using light. This is a syntonizer. This is this instrument here. It's one of the major ways we give the light into the eye. A person sits in front of it for 20 minutes. We use certain frequencies or filters. It's a simple device. It has a glass filters we put in. It has a frosted lens here where the eyes are looking. And then we take an incandescent bulb that has a vibrating filament that we can put more current in and bring it up to 145 volts, provide a more full spectrum light source. And again, a person is in front of this instrument for 20 minutes, typically 3 times a week for up to 20 sessions. Some of the conditions treated by light in this fashion is brain injury, stroke, severe and mild traumatic brain injury. And that's becoming more and more common and more recognized in our healthcare system than ever before. Some of the other things that are involved in needing treatment and other forms of brain injury are called by high fever, especially with children, toxemia, hypoxia, which means not enough oxygen to the brain, and emotional trauma. These are all can be addressed by syntonic light therapy. Another source of problems is problems with pregnancy and birth insults. Even before birth, things happen to the mother that affect the brain that we can actually diagnose through testing. We treat headaches, and eye strain, strabismus, which is like a lazy eye, where one eye doesn't work with the other eye, it turns in or out or up or down, not coordinate with the other eye. It's usually used to be called a lazy eye. Binocular and accommodative dysfunctions, that is problems with eye teaming, eye coordination, and accommodative dysfunctions are your focusing mechanism of your eye, which are innervated by the autonomic nervous system, changing the way the light focuses. There are many different kinds of accommodative dysfunctions that can be directly treated with light therapy. Amblyopia, which means reduced vision in one eye, even though a person can have glasses that make the light focus where it should, the brain can't see it clearly. So that's another form of a lazy eye. Also treated is a wide range of ocular pathology, but the most common ones are glaucoma and age-related macular degeneration. In addition to that, the light therapy Syntonic works on attention problems, learning, and reading disabilities. Many attention, learning, and reading disabilities are primarily auditory, but are actually processing visual information. This is just a simple illustration. Here's a child 6 who was failing in school, couldn't learn, severely hyperactive, very aggressive, couldn't sit still, always acting out. She actually was banging her head every day to stimulate herself. She had a toxic exposure from exposure to the mother during pregnancy. When we did an exam, we found that she had poor vision skills, couldn't coordinate her eyes, couldn't track, couldn't focus, but especially had constricted visual fields. So if you look, this is a field where you would bring an object in from the side and you would tell us when you could see it coming. Normally you would see it coming way out here at the edges of the paper. She couldn't see it till it was right there. So she was walking around with tunnel vision. And that was really the key visual dysfunction, was affecting all of her behavior. She was treated with 10 minutes of ruby light, followed by 10 minutes of yellow-green light 3 times a week for 20 treatments. The ruby light is an emotional stabilizer, and the yellow-green is a detoxifier and a physiological stabilizer. And I was mentioned, there's about 11 different colors, frequencies that are used for different problems. The result of these light treatments, and that's all she did, was the field opened up like this. And this is now becoming normal. And this is what's called the blind spot, where the nerve leaves the eye, there's no vision, and that's a normal now. When that happened, everything changed. All her vision skills normalized. Her hyperactivity was gone. She began to read. School performance was up to grade level after just like a month. And she began gymnastics with great enthusiasm. The parents were thrilled to have their daughter be back as a loving and gentle child. That's one of the miracles of this work. So we used to call it the miracle workers when we'd use those frequencies, to see changes like that in such a short time. In addition to, excuse me, in addition to looking at the light, we often incorporate goggles and do movement. This is what's called gaze facilitation, where they're wearing a syntonic goggle while looking into light at different directions of gaze. And that illuminates the light into different brain centers. When we do it at certain angles like that, it can emphasize stimulation to different parts of the brain and also into the postural system. Another aspect is we can put light right into the eye. In this particular case, there are lights, it's a red and blue light putting right on the insertion point of the extraocular muscles, and that's called focal syntonics. And that's used to change the actual range of motion of the eye muscles, and also to affect there are the major cranial nerves in the eye that are in the middle of the brain. You can affect the cranial nerves and how they interact with many other brain functions. The way we measure that is by doing a test where we have you look at certain directions of gaze. And this test, called a Hess test, you can find out which muscles are overactive. This is what's called the inferior oblique, and then which ones are underactive, which is called the superior oblique. So we can analyze each muscle function from each eye and see where the cranial nerve is either overactive or underactive, and apply light to change that balance. So again, we're doing this, when we're doing this insertion of color on these points on each muscle to influence the nerve, we see other things changing, such as the cranial bones in the head, which are all moving and not fixed. And that's what craniosacral is about, craniosteopathy is about. You can shift the cranial bone positions by putting light into the eye like that. And through the dura mater, which connects the base of the spine all the way up into the brain, the spine will actually shift its tension, and we'll actually see changes in people's posture and also even improve balance just from simply putting the light into the eye. So it's like craniosacral therapy through the eye. And those are just a picture of the muscles that are directing the eye in all different directions of gaze. And these are the muscles you can reach right from the exterior points by putting light in the insertion points of where these muscles are in the eye, on the globe of the eye. Here's a common, there's one when people are nearsighted, you would put light on certain set of muscles to stimulate them, and other muscles where the blue is to relax them. And so you can actually take somebody who has an irregular shaped eyeball and change the shape by putting light to affect the muscles, which in turn can accept the shape of the orbit or globe itself. So another aspect of the light therapy is what I was just alluding to, is about the cranium. So we look for actual cranial strains. That's done by usually a physical therapist. In our office, we had 2 physical therapists, and they can see the strains in the cranium, how the bones are out of alignment, and then we can use light to support changes. But we also work with them to help posture and balance. It's in response to the optometric phototherapy, because many vision problems have postural problems, because the neck, the vestibular system, and the cervical system, that is the upper neck, are all working together at all the time. So the eye muscles are connected to the neck and to the inner ear and to the tension in the neck. So there are fixation points that have to be considered. So we look at these different fixation points, anywhere from the sacrum to the sternum to the cranium, which is the occipital and sphenoid bones, to the jaw. And so we also see when we prescribe color and eyeglass prescriptions and prisms in conjunction with physical therapy, we can make changes in the whole cranial system. So we work in terms of neuro rehab, where there's been brain damage, you'll see changes in posture, balance. All these things can be aided by, especially with the team approach of physical therapy and neurooptometry. And that's just a simple picture of the spine, and so we take this into account. We look at the patients, but also work with therapists that are specialists in postural system. And inside the eye, this is the sphenoid bone, the occipital bone. They're moving, reciprocating with each other all the time. And all the extraocular muscles, or at least not all, 5 of them, actually have their insertion points right directly into the sphenoid bone. So when the sphenoid, every time you move your eyes, the sphenoid bone is moving too. But if the sphenoid can't move, it isn't moving in reciprocally to the occipital, the back of your head, then you'll have all kinds of visual dysfunctions that the eyes, the position of the eyes, and affect coordination and focusing and such. So this is another consideration we bring into the picture when we're treating with light. So there are also other energetic or adjunct modalities that we use along with Syntonics. One is microcurrent. One of the things we use is a device, which in fact I invented a device, and I was the first one to invent and patent a microcurrent device for eye problems about 25 years ago. And we would use my device using 200 microamps, or another kind of microcurrent, especially the one that Dr. Kondratz uses, frequency-specific microcurrent, would be used in conjunction with the light therapy. We also can use auditory input by using tuning forks, to use tuning forks that have the same vibrational effect of the color, just at a different octave of energy. We can do dynamic vision therapy, which is, there was a picture earlier of somebody looking in a gaze. We put people on balance boards, drivers, which is shifting your weight back and forth, and we have a trampoline in the office. So we can use the light therapy as what's called active syntonics, not just sitting in front of an instrument and looking at the light, but bringing these other systems into the conjunction while the frequencies of light are being presented into the eye. And this all plays an important role in postural rehabilitation, because again, the eye and the postural system are completely interrelated and interconnected. So some of the other devices that we use that are what we call photobiomodulation, that is using focalized light into different areas in order to affect changes for vision problems. One device in particular that we've used with a lot of success is called a Photon Stimulator. This device was designed to apply light, focalized light to the acupuncture point. So what it is, it's a device that has you can put colored light in, it has a light source, and then through has fiber optic system, you can bring the light through this fiber optics into a small node and apply the light in a very small area. And these are just two of the devices that are these photon stimulators. So we can put in the device different colored slides, put whatever color we want into a focal, just a very small amount of light, and then focus that on different areas. So one of the areas we've had, let me just make sure I got this right here, yeah. One of the areas we've had really a lot of success with is based on some research from Dr. Ivanek in Germany. He found that when he put lights on the macula, it would improve the vision of degeneration. Somebody's got their microphone on, by the way. You can mute it. So we put red light on that small focalized area into the macula by having the patient look towards their nose and putting it through the temporal conjunctiva right on the macular area. In a 40-second treatment of red light, we've seen people's acuity improve instantly from 1 to 4 lines of acuity. And I looked at 6 patients in this little schematic here, and we saw people go from 2800 to 2200, 2100 to 2060, just with 40 seconds of direct illumination of red, which is energy-giving light. Red is soaked up by the mitochondria and the producing ATP in the macular area. You see immediate improvements in acuity. So when we see this, we have the person purchase this device and treat themselves at home, and that's been very good. But even in the office, we see it can last up to a month, the effects. Another device that we used is what's called audiovisual entrainment. That is where you flash light into the eye. You can also flash it to different hemispheres, not just to the center of the eye, but to the right or left hemisphere, and train the brainwave patterns by shining the light and having auditory input at the same frequency beats of the light. So if the light is flashing, let's say 13 cycles per second, the sound would be doing the same thing. And you can entrain the brainwave patterns. And that has really profound effects on especially on brain injury, but also you can use it for hypnotic induction. You can calm the autonomic nervous system. You can increase heart rate variability. You can increase cerebral blood flow. You can increase neurotransmitter activity by balancing out the brainwave patterns, by entraining the brain to the light sound input. So the brainwaves will immediately start entraining, and you can do it with the right hemisphere, left hemisphere, or both at the same time. So in the office, we've had that, especially for people who have sleep problems, which is very common with brain injuries, and also attention deficit disorder and attention deficit hyperactive disorder, so attention deficit with hyperactivity. So this visual audio restores the brainwave patterns, each hemisphere by presenting light to the right or left fields along with pulsing sound. And that's what the device looks like. And that comes, one we're using is from Mind Alive there in Canada. By the way, I have no financial interest in anything that I'm talking about here device-wise. So that's the headphones. You can put in you can program in the light frequencies, and use color. You can use color to the different hemispheres as well. So it's a very interesting technique. If you go online to Mind Alive, you can read about their studies and their devices. So photobiomodulation is really designed to deliver primarily infrared light to the brain. And that's being done in many studies showing it affects Parkinson's and Alzheimer's and brain injury. Specifically in the office, we found if we pulse red light at 40 hertz, it helps Parkinson's patients and Alzheimer's. And we use something called a Lumitron to do that. Also, water is a very powerful way. Structured water has a peak absorption of about, in infrared, about 3,000 nanometers. So if you put light into the head, especially infrared, which is more very deep infrared, like 3,000, you can go right into the middle of the brain. You can affect these cells in the brain itself, affecting all different kinds of, there's hundreds of different pathways and studies now that you can investigate. So if you go online and look up the field, you'll see they're using focalized photobiomodulation of specific light frequencies, mostly red, but now they also green and blue. It can have changes in all kinds of healing. In the office, we use low-level light therapy, or a laser called the delta laser. And I know Dr. Kondratz is very familiar with that and uses it with most of his patients. The delta laser is from a company called Multi-Radiance Life Technologies. It's a multi-radiance device that has 4 basic energies. It has infrared, about 905 nanometers. It has a pulse magnetic field that's around the laser to increase the depth of penetration and effect of the laser light. It has LED lights in a certain presentation of using red, red, yellow, green, and violet in order to have stimulation of the different brain pathways, but also as an information conduit. That is, light can also bring information to change the way physiology systems are integrating. And it also has ultrasound, and the ultrasound is used to increase the enzyme effect of all the energies you're putting in. And what we found is when we use all these 4 modalities, the red, the infrared, the magnetic fields, the ultrasound, and the color presentation in a certain geometric pattern, we do the multi-radiance. We found it has very powerful effects on the cells, and it's a very powerful tool. So an instance where we've used that is where we have, give you an example, we had somebody who had an optic neuropathy. That is, they had a brain tumor which was removed, and then they had a brain bleed in a certain area, and I think it was the right temporal area, and it paralyzed one of the eye muscles. And so the eye muscle, the cranial nerve to the muscle was damaged, and so the eye muscle was muscle to pull the eye out, and the eye couldn't go out, so the eye turned way in. It went way in, what's called 40 diopters, huge amount of turning in. The patient had been seeing double for 3 months. They had given her high doses of steroids, and they eventually, and they tried different things. Nothing could get her eyes straight. Previous to that, she had normal vision, never had double vision. Now she had double vision all the time. And so they started just patching her, and that's when she came to the office. And after 6 sessions of putting the delta laser on that site, the crossing went from 40 units, which is a lot, down to 9 at far and 14 to near, and the double vision started to completely go away. He was coming in 3 times a week for these treatments of only 5 minutes on those 5 minutes on the side and 5 minutes on the eye. After another 6 sessions, the eye was completely straight. Her eye was also aligned vertically, which it wasn't before, and we discontinued therapy, and she thought it was a miracle. And in 2 weeks, basically, actually it was more like a month total, her problem was completely solved. Another instance of the same things, we had somebody who had a hemorrhage site following a heart attack and a cerebral bleed. Again, her eye was crossing, seeing double all the time. And again, after he had been on 3 months of steroids and patching by ophthalmology with no change. And same thing, after the treatment, his eye was able to straighten right out, and he was able to fuse. And again, it was like an amazing, to put that energy into the site of the stroke, had these profound effects. So this whole field of photobiomodulation is a big topic in itself. Maybe sometime we could have a lecture on that, which I'd be happy to do. So I've kind of gone through this whirlwind exposure of different applications, and I wanted to just give you some conclusions of what I've seen over all these years, and using all these different modalities of light. And light therapy is used with every single patient that we do therapy with. We may do exercises, we may prescribe prismatic glasses and other things, but every single patient gets light therapy. Can't imagine practicing without it. You can't imagine practicing without it. So when we talk about vision, we have to take a holistic approach. We know that it involves your emotions. It involves your whole physiology, your physical being, your hormonal system, your autonomic nervous system. So we have to, in terms of therapy, we've got to look at all the systems that we can ascertain how they may be contributing to the vision problem. Take a philosophy, what's called network physiology and the autonomic nervous system. What network physiology means is that there are all these systems in your body. There's no linearity. The body's physiology is in disequilibrium at all times. It's constantly making new connections moment to moment with different parts of the autonomic system, with other parts of, for instance, like the eyes, the breathing, the heart, and the respiratory system are all systems that are communicating all the time. And the research has shown that there are these cybernetic connections, feed forward, feed backward connections that are going through all these systems that are interacting every moment of your life, every time, all your moments of living. These systems are interacting with each other in different ways, and they communicate through frequency. So the research is showing that the communication from the heart to the brain, to the eye, to the respiration, the eye to the respiration system, or the heart rate, are all communicating by frequency. And they're now starting to measure the frequencies that are used in communication, so you can start to see which systems are not online that's supposed to be, and start to treat people from a holistic approach, realizing that there's all these systems are interacting at all times, and they're not in equilibrium. There's no linearity. You can never look at one little spot and say that's a problem and try to treat something from one spot. So what we find is that in this particular physiological model is when we put light into the eye, we can send a signal that can be transmitted and start having tertiary effects with lots of systems that bring them into connection, into balance. So light is a major signaling factor that we can access right directly to the brain through the eye. Vision and light are essential to our consciousness. Our awareness of the world is totally, 80% of your sensory input in your brain is vision and light. And light is essential to our awareness, our consciousness, and it's a basis of our learning and our awareness of the world, in our mental states, emotional states, all states. So all disorders in the whole physiology, we can relate in a very simplistic way to the loss of rhythm and tone. That is, the nervous system has lost the rhythm connection, or the tone, the energy content is disconnected. And so this rhythm and tone, especially in terms of the vision problems, can be restored by using certain light frequencies. Another basic conclusion is biophysics underlies all biochemistry through the liquid crystal matrix. That is, our body is full of liquid and crystals, water, structured water, water through all the connective tissue, through the fascia. And the way the system, the way the biochemistry works on a cellular basis is dependent on the liquid crystal matrix communication, which is done through biophotons that are generated within every cell by the DNA, and also through the biophoton communication that links all the systems of our body through this liquid crystal matrix. So it's not just the blood, it's not just the nervous system, but there's this whole basic liquid crystal matrix system that underlies the biochemical effects that are going on. So biophysics is really the energy component that really drives the biochemistry. Another major conclusion is the eye is a fluid organ. It has cerebral spinal fluid in the eye, and it's directly connected to the eye. And that the cerebral blood flow, all the blood flow to not just to the eye, to the central nervous system, but to the peripheral nervous system, integrating, it's one of the major pathways is liquid and water. And so the water itself can structure itself. The work of Jerry Pollack, the fourth fourth phase of water has shown how water in our body has a certain fourth phase of matter that stores energy, and that energy is used to drive the metabolism of all of our biochemistry. And what the water does is it stores light, and that light is used as the main energy component to drive most of all our metabolism. So because of these basic understanding that water and light are so fundamental to life itself, I conclude that life and water are the foundation of all life. And so if we're not looking at life and water, light and water, we're missing a big part of the picture. So that's I think that concludes my talk. And I'm going to now go out of this, and then we can move into questions.
Dr. Wallace, great presentation. I really enjoyed it. And I agree with you. And every one of my patients who's involved with one of my programs is getting some form of syntonic light therapy or a combination of some other devices that you mentioned. So can you see the chat? We have a lot of questions.
Yes, you can see that. I can bring it up.
If you wanted to go through the questions, and then if we have time, then we'll have the opportunity for people to raise their hand to ask a question.
Okay,
verbally.
So it says, do I have an opinion about the Maculum Cognitive Brain Helmet? Yes, I have a colleague who's using it, is talking about how great the results he's getting. And next week, we're having a conference in Albany, New York, where I'll be lecturing about photobiomodulation. He's going to present this device, and he's going to tell us all about it. So he's had great results, and I'm very excited to learn about that device. Can syntonic light therapy help someone who had a stroke many years ago, and it must be used closer to the stroke to be effective? It's better to use it closer, but no, it's not too late. You can have a stroke many years ago, and it can cause certain kinds of dysfunctions that can still be treated by light therapy, even though it's been many years after the stroke. So it's never too late to try. Any help for macular pucker with edema? Sometimes. There's certain light frequencies that can facilitate reducing edema, soaking up fluid, and that can be very helpful in macular pucker. But sometimes you just don't know. But there are specific treatments for that.
Dr. Wallace, I think in combination with microcurrent, light therapy in combination with microcurrent can be effective.
Very effective. Thank you.
Macular pucker.
Where can you get a syntonizer therapy in the Virginia area? Well, yes, if you go to the College of Syntonic Optometry, and you can find practitioners all over the country. So the website is CSO vision.org. CSO is College of Syntonic Optometry. So CSOvision.org, and from their site, you can find practitioners of light therapy syntonics throughout the whole United States. So there are practitioners in most states. Can light therapy reduce or prevent cataracts? Oh yeah, certainly on the early stages. It can prevent it, it can reduce early stage cataracts. We do have drops now that actually dissolve the cataract, which can be used when it's been more advanced or more progressed. But yeah, early therapy. In fact, Spittler did some of his original lectures using blue-green light to reduce early cataracts. So yeah, that's definitely something to explore. I don't know. Let me see what else I've got here. It doesn't see. Looks like that's all the questions. Oh wait, here's something else. No, there's more. I did get some more I didn't see. Here's one that I didn't see. I can get it to scroll down. Having trouble moving it.
There's a question about optic nerve damage.
Yeah.
I know that using light therapy in combination with microcurrent can often reverse optic nerve damage.
Yes, in fact, there's a number of studies, especially done mostly, well, now in the United States and in Russia, a lot of studies showing they can treat optic nerve pathology with light, focused light and microcurrent as well. So yes, there's definitely hope for that. I'm not sure where I am in the chat thing here. Okay. Stroke, syntonizer, scar on my optic nerve, thinning and damage, currently blood pressure changed. Regarding if the retina and nerve changes, oh, I lost it. Can you use light in your eye to lower blood pressure? Absolutely, yeah. Yes, absolutely, you can use it to help lower blood pressure. What's the name of the company provides infrared light systems?
They might be referring to the Delta Laser Company.
Yeah, that's a Delta Laser. So that's multi-radiance life technologies. And you would have to look them up. And they're the ones that make there are many Delta lasers out there. So you want to use the company again, radiance life technologies.
You can always contact our office and we'll be happy to give you the link or a way to order some of this equipment.
So there's a question about glaucoma. Yeah, we have patients that use light therapy for glaucoma. You can lower the pressure with certain applications of light, but also we have people that are taking like 3 drops, and we only want to. We can get them down to 1 drop that isn't irritating their eyes, and use and complement their therapy with light as well, and with microcurrent.
Remember, Dr. Wallace, I presented a paper on the use of light therapy to lower intraocular pressure. And you might want to mention, the traditional ophthalmologists may say or scoff and say that light therapy has no effect with glaucoma. But in the American Journal of Ophthalmology, which is a peer-reviewed journal, there were 2 articles published in the early 40s. Remember that article?
Yes. And now there's more, because if you go to look in the field of photobiomodulation, you're going to see that there are more studies now working in these eye problems.
And then LX Laser has a laser device which emits low-level energy in the form of directly treating the macula, and their studies have shown to reduce macular degeneration. So there's so much going on out there supporting all the work of syntonic light therapy.
Yeah, and it's all part of frequency medicine. So that's what the microcurrent is all about, frequency medicine. So there are definitely applications, especially when you use, again, multi approaches like Dr. Kondratz does. I find that that's the most powerful of it all. You're going to use light and microcurrent and nutrition and etc.
Oh, here's a question. Somebody asked, what's the difference between syntonic phototherapy and Dr. Kondratz's light therapy? Well, I'm using Syntonic.
Right.
In fact, I'm probably the only ophthalmologist who's a member of the College of Syntonics. And Larry helped me pass my examination. Remember Larry?
Right. Does it help floaters? Not so much. There is a filters for floaters, but over the years, we've not had great luck using light therapy for floaters. Ask where I'm located. I'm located in Ithaca, New York. So if you Google my name in Ithaca, New York.
There's a question about your book. When is it going to be released?
I hope by the end of the year. Yeah, it's been fine. The final editing has been done. So the next stage is, whatever.
And all of you are on my email list. So as soon as his book is published and ready to go, I'll send all of you an email with the link that you can order his book.
So what else? Okay, advanced, yeah, so advanced cataracts, what drop it's called Aquamed, OC, and I know maybe Dr. Kondratz had other ones as well, but the
No,
one
no,
we
I,
use-
that's a routine. That's a drop that I use routinely for all my cataract patients. In addition, Syntonic light, depending on the indication, but most frequently I use mu delta to help
Right.
detoxify the eye and put energy in.
Right, that's a yellow-green filter. So
Mhm.
yeah, Aquamed, OCLUMED, Aquamed. And we've been using it for years and with wonderful results. And so what we do is we prescribe it and then we check the people. We have special devices to measure the actual, extent of your cataract. And then we want to see changes, vision, contrast sensitivity, and also glare reduction as a result of using the drops. So we can use them, do them for 2 months and then see the change. So does it really work? Absolutely. There was national studies on Aquamed that showed something like 90% effectivity. And the problem is that it can't be approved by the FDA because it's impossible to get things like that. It costs hundreds of millions of dollars.
And
So
also
there
all
are-
the eye surgeons are fighting
the eye
against
surgeons
getting
don't
it
like it.
approved.
Yeah, whatever when I send the patients eventually may need surgery and we send them to the surgeon, they always say, why are you taking those drops? Well, meanwhile, they've been taking them, they could have needed surgery years ago.
Mhm.
Something about lipoflow. Yeah, that's using blue light on the meibomian glands. And we found that that little device I showed you called the Photon Stimulator. We put red light right along the glands of the oil glands underneath your lashes, and immediately the glands open and start exuding oil. So there are lipoflow. I think is more where they squeeze those oil glands, but you can use light to open them up. And now they're finding blue light also has the effect. How often do you use the drops? We use them 1 drop twice a day. And after a while, people can start using 1 drop a day after a few months. Looks like I've gotten all the chat things, I think.
Does anybody have a question? Oh, somebody's raising their hand. Let me see. Charlene, let me unmute you. Want to unmute? I'm trying to click you to unmute.
Unmute. There we go. Can you hear me now?
Yeah, we hear you.
Okay, great.
Dr.
Thank
Wallace,
you.
Do you hear her, Dr.
Oh
Wallace?
yeah, yeah, I hear.
Thank you both for Dr. Wallace, your presentation was blowing me away. You're awesome. Thank you for all your research, Dr. K. Thanks for putting this together for all of us. My question is twofold. You're kind of answering about questions of cataracts. I had a traumatic brain injury in 2005 and 1 in 2013 and 5 concussions. I have a blood bleed in the occipital region of the right area, and the cataract in my left eye refuses to leave. And we've tried everything. And after listening to your presentation, it's like, wow, I'm trying to put the pieces together to say, would the light therapy help? Because when we did it in the beginning, it was my brain was so injured, it was too challenging to deal with it. It blew me out.
You mean you tried light therapy, it was too strong at that point?
Yes.
Who prescribed it?
And neuro-ophthalmology doctor here in town.
A neuro-optometrist, maybe?
Yes.
No, okay, not an ophthalmologist, because they don't generally do that. Yes. So sometimes you have to do it very gently, and you can only do 3 minutes of the light. So especially in acute stages, you have to gradually build the time. So you might have to give, let's say, blue light for 2 minutes, and then later more. But it has to be gradual, because it could be overwhelm you at the beginning. So you may need to try again. That's what I would say.
Thank you. I get. And the glare, what can we do about the glare when you have cataracts?
The Aquamed is the main thing, or take the cataract out. Yeah.
No, we're not doing that. It's going to dissolve itself.
Try the drops at first.
Okay.
And that's one of the main effects we see And using the drops is the reduction of glare because the cataract scatters the light inside your eye. So as the cataract dissolves and reduces the protein, calcium, things that are coating it, the light scatter goes down and that reduces the glare. So we do glare testing to see if that's actually happening when people
Great.
take drops, right?
Thank you.
Okay, thank
Yay.
you.
Can you use the drops for if you have glaucoma?
Well, not those drops.
Not
No, not the cataract drops.
Okay.
Well, you can, they're not going to cause a problem with the glaucoma, but those drops really don't treat glaucoma.
Right, yeah, they won't interfere. They won't have any negative effect on the glaucoma, right?
But actually, you know, they may
But
have
now I
a
had
positive
cataract
effect.
surgery and had the cataracts removed.
Oh, okay.
Should I be using the drops anyway?
No,
No.
I wouldn't use them anyway.
Okay.
I would do other things. You may need to do other kinds of therapy, but not the cataract drops.
Okay. Thank you.
Okay.
There's
Betty
another
has a
question.
here.
Yeah, here,
I think Betty.
Janai,
has some-
Yeah,
let's see.
I had a quick question. It's I just got over the Omicron virus, and it seems like I must have burst some blood vessels when I was blowing my nose, you know, and my vision is not as sharp as it was in my right eye. Is that just going to take time to recover, or
Well, yes, I mean, yes, I would hope so, but long-term COVID is a big challenge. And it's kind of like also like Lyme disease is a big challenge. So there are other therapies you could be incorporating to help you recover. Things that probably using light would be one of them in terms of restoring the energy in your system, because COVID is a major part is that extreme fatigue and that draining of your system. So you can use certain colors to get your adrenal system retoned, start improving your energy, you're reducing your fatigue.
okay?
Oh, Janai, you have a question? Let me unmute you.
I sure do. Can you hear me?
Yes.
Dr. Wallace, you here?
Yes.
Awesome. Thank you so much, Dr. Wallace, for that presentation. So much hope in that presentation for me, and just so many amazing technologies out there that I'm really ready to explore. I had a question about, you mentioned, it's actually two things, the shape of the eye, and I know I had always had an astigmatism. Has the light therapy in certain positions had any impact on astigmatism?
Yes. In fact, that focalized light, you see, the astigmatism just means the eyeball is irregular in shape, horizontally different than vertically. So you measure the eye muscles that are involved in squeezing the eye irregularly, and which ones are the other ones that counter it are out of, don't have enough energy. You can use that treatment to reduce astigmatism.
That's amazing. And you have used words, I've heard, and even Dr. Kondratz used the word regeneration of optic nerve damage, which that intrigues me. And I just want to know if I've heard that right. Is this possible to recover some of the activity of the optic nerve through light therapy?
Yes, I mean, there is always a limit. If the tissues are dead, if there's no physiological, life to it at all, you're not going to restore those things. But a lot of the nerve fibers, they're not dead. They're very weak. They're inactive. So there's regeneration.
We lost you, Dr. Wallace. Larry? I don't know if you can hear me. Dr. Wallace, we lost you. Let me call him. May have been a problem. Can you all hear me or?
Much.
Ed, we don't hear you because you're muted.
You-
Ed, you're
Oh, yeah,
muted.
we lost you for a while, Larry.
Oh, okay. I'm here now. What's happening now?
Okay, any other questions for Dr. Wallace?
Okay, well, I want to thank you all for coming and you know, it's really a great opportunity to share with you. Thank you so much for being here.
I have a quick question. What do you think about Dr. Rowan's eye drops as compared to Aquamed? He's the editor of Second Opinion newsletter. He has his own eye drops.
Yeah, I don't know. I'm not familiar with
I
it.
can answer that. I've used both eye drops, and I think the Oculomed is more effective. And also there's a lot of problems in getting compounding pharmacies to make Dr. Rowan's eye drop. They tend to be more expensive. They don't last as long. I think the Aquamed is a much better product.
Thank you, doctor.
All right, well, listen, I want to thank Dr. Wallace especially for taking time. And this is just the first Saturday we're having with the Vision event. Look forward to joining all of you next Saturday. And I'm sure we're going to have Dr. Wallace speak again. So thanks, everyone. Have a good weekend, okay? Stay safe.
Okay.
Thank you.
Thank you.
And
Good
this
show.
this is recorded, so I'll be sending
Thank-
you all a link, okay?
Thank you.
That was
Thank you.
great. Thank you.
It was great.
Really good.
Thank you.
Thanks.
Thank you.